Approximately once a year, I've got a speaker from Australia, and it's always interesting to listen. Where is my health record, at the moment? I still remember when I had a speaker when there was a lot of controversy that the system went from the opt-in to the opt-out system.
That's right.
So, what changes are you seeing, since the rollout of the solution, and what are your perhaps anticipations for the future? Because all these solutions, when it comes to, national repositories, national backbones, they need some time for the doctors to also start using them.
Correct.
So we also have to take that into account when assessing is something meaningful or not in the long term.
Yeah, yeah. And I've got some other insights to bring to your question from the work that I was involved in the Health and Human Services Access Card. So back in 2007, so quite a while back, but a very similar type of model where it was a centralized model of access. And this breaks down in a whole range of different areas. And the purpose must be really clear. If the purpose serving the government in terms of having, this great collection of data, is the purpose serving the provider, or is the purpose serving the individual person, the citizen? And all these things are different. And so having a centralized repository from a provider's perspective is layers of red tape and administration. Then there is the model where literally thousands of providers and points of access to this centralized database can occur. And this creates security and privacy issues to work through. What has happened as a result of that is there have been people whose records have not been updated, or where the incorrect updates have been made, so somebody else's files have been updated. And there is also paradigms which this centralized model locks in. And one of those paradigms is that the records that are updated are often PDF records, or records that are not able to be searched or analysed. And so it becomes almost a repository of records that don't provide a lot of value, definitely don't provide a lot of value to the provider, don't provide a lot of value to the citizen. They might provide some value to the government who might be doing health informatics or health analysis on these records. And so I just think the purpose there is not clear. And in Australia, there's literally been trillions of dollars spent on this, and still there's problems with it. So I think what's happening is, whilst the government's going down this particular path, there's an explosion, say, in the Apple Health ecosystem and in other similar ecosystems where the person, the people, the citizen is now saying, I've got more in my hands, in my phone, actually, than what exists on that health record. And for me, that is way more valuable. There's also a whole lot of other accessibility issues. If you think about in Australia, with the size of our country and our network coverage in some of the remote areas is not all that good. And so you've got a paradigm that says, well, we can serve some people even with this paradigm, but we're not going to be able to serve everybody. And so it becomes a system that actually is not just.